everyone. So today let's discuss the scapula. The scapula is a flat triangular bone that is placed at the posterolateral aspect of the thoracic cage. This scapula extends from the second to the seventh rib, and it tends to act or provide support to the muscles of the forelimbs, and then it is also attached to the clavicle in front, and it provides an articulation for the humerus at the level of the glenoid cavity. This simply means that the head of the humerus articulates with the glenoid cavity of the scapula to form the glenohumeral joint, and it provides support for the muscles of the forelimbs, which we are going to talk about when we get to that part. Then for the posterolateral aspect, it simply means it's placed at the back and then in a way that is facing laterally, which means away from the midline of the body. Then let's talk about the features of this bone. The first one is the surfaces. So the scapula has two surfaces. It has the dorsal surface and the costal surface. Then it has three borders. It has the superior border, the medial border, and the lateral border. It has three angles. It has the superior angle, the inferior angle, the lateral angle, or the glenoid angle. And then it has three processes: the spinous process, the acromion process, which is a continuation of the spinous process, and then the coracoid process. So we are going to take it one after the other. The first one we are taking is the surfaces. The surface of the scapula are two: the costal surface and the dorsal surface. Now let's take the costal surface. The costal surface is smooth and it is concave. Okay, it presents or is being marked by three longitudinal ridges, okay, that provides an attachment for the intermuscular septum, and it also has a thicker ridge that adjoins the lateral border. This part of the bone acts as a lever, and it's somewhat rod-like that aids in the overhead abduction of the arm. This action is being performed by a muscle called the serratus anterior muscle. So this serratus anterior muscle aids in the overhead abduction of the arm, and any injury to this muscle causes winging of the scapula. This muscle is also supplied by a nerve called nerve to the serratus anterior, or the long thoracic nerve. Now, there's something you are supposed to use to differentiate the costal surface from the dorsal surface. The costal surface does not present a spine. So that means the costal surface has no spine, but it has three longitudinal ridges. It has the serratus anterior. It is concave, okay? Now, let's go back to the dorsal surface. The dorsal surface presents a spine, unlike the costal surface. This costal surface can also be called the anterior surface, okay? Now, and it's this costal surface that faces the thoracic cage. When we go to side determination, I'll explain that better. Now, let's go back to the dorsal surface. The dorsal surface presents a spine. This spine divides this dorsal surface into a small supraspinous fossa and a large infraspinous fossa. These two fossas are connected by a spinoglenoid notch. This is what we call the spinoglenoid notch. So that's all for the dorsal surface. Now let's go over to the border. We have the superior border, the medial border, and the lateral border. Now the lateral border is thick, unlike the superior border and the medial border. So the medial border is thin and somewhat short. The superior border is thin and somewhat short, while the medial border extends from the superior angle down to the inferior angle. So the medial border is like this and is also thin. Then the lateral border is thick, and at the up part of the lateral border presents an infraglenoid tubercle. Okay. The superior border, at the roof of the superior border of the scapula, presents a suprascapular notch. At the roof of the coracoid process of the scapula presents a suprascapular notch. That is one of the features of the superior border. Now this suprascapular notch is being breached by a transverse ligament, but when we get to ligaments, I'll explain it better. So it's breached by a transverse ligament, but I'm not going to tell you the function of that ligament now. So stay tuned to the end of this video. Now let's go over to the processes. The scapula has three processes. It has the spinous process, it has the acromion process, and it has the coracoid process. Now let's take the spinous process first. The spinous process is found at the dorsal surface of the scapula, as I've said initially, and this spinous process tends to divide this dorsal surface of the scapula into a small supraspinous fossa and a large infraspinous fossa. Now the spinous process of the scapula also has it has three borders, okay? It has the anterior border, it has posterior border, and it also has the lateral border. Then it has two surfaces. It has the superior surface and the inferior surface. Now let's talk about the anterior border. The anterior border is placed at the uppermost part, while the posterior border has two lips, the upper lip and the lower lip. Then the lateral border forms the spinoglenoid notch. So let's take it over again. The spine or the spinous process of the scapula has three borders and two surfaces. It has the anterior border, it has the posterior border, which has an upper lip and a lower lip. Then it has the lateral border, which forms the spinoglenoid notch. This notch is also breached by a ligament called the spinoglenoid ligament. When we get to that attachment on the scapula, we'll explain it better. Now it also has a superior surface and an inferior surface. Now let's go back to the acromion process. The acromion process is a continuation of the spinous process. This acromion process actually also has borders and surfaces. So it has two borders. It has the medial border and the lateral border. This medial border continues with the upper lip of the crest of the spine, okay? While the lateral border continues with the lower lip of the crest of the spine, okay? So it has two borders and two surfaces. Two borders and a lateral border and medial border, two surfaces, superior and inferior surface. Now let's go back to the coracoid process, the last process on the scapula. The coracoid process resembles a bent finger, and it always faces forward and somewhat laterally away from the body. Let's talk about the angles. The angles on the scapula include the superior angle, the inferior angle, and the lateral or glenoid angle. The superior angle is being covered by a muscle called the trapezius muscle. Then the inferior angle is covered by a latissimus dorsi muscle. This latissimus dorsi muscle plays a role in adduction, extension, and internal rotation of the arm. This muscle is also known as the climber's muscle and is being supplied by the thoracodorsal nerve, or a nerve to the latissimus dorsi. Now let's talk about the lateral or the glenoid angle. This angle faces laterally away from the body, and it is at this angle that the head of the humerus articulates with the glenoid cavity to form the glenohumeral joint. So that is for the features of the scapula. Let's go into the side determination of the scapula. How do you tell if the scapula is a left scapula or if the scapula is the right scapula? I'm going to show you. The first one is that the costal surface should always be faced towards forward, okay? You are supposed to always face the costal surface forward, and the dorsal surface should always be faced backward. If you put it like this, you are holding it wrongly, or you are placing it wrongly rather. So you should place the costal surface in front. You should always be facing the thoracic cage, and then the dorsal surface that presents the spine should always be facing what? Backwards. This is because it is the acromion process that will articulate with the clavicle in front to form the acromioclavicular joint. But if you place it like this, there is no way this acromion process will articulate with the clavicle at the back. The clavicle is not at the back, the clavicle is at the front. So you place it like this. Good. Now let's place this bone and know whether it is the right bone or the left bone. I've placed my costal surface in front, my dorsal surface is back, and another thing, the lateral border is thick, so your lateral border should be facing away from the body laterally, and then the lateral, anywhere you face the lateral border, obviously you're already facing the lateral angle or the glenoid angle. So this is the way to place this bone, and I've placed my bone like this. So what side of the bone is this? Now let's check. This is the right scapula. This is the right scapula, because when you place this bone like this, you see that this acromion process is articulating with my clavicle in front, and this glenoid cavity would fit directly into the right humerus, okay, the right humerus, to form the glenohumeral joint. But if I place it this way, there is no way that the glenoid cavity can fit into this place, and because my arm is not here, okay, this is a wrong placement. But if it was the left bone, you would have seen that it will correctly fit when placed that way, because this place will go like this, the lateral end will now be like this. Remember, I said that the costal surface should always be placed like at the front. So when you place it this way, in order for you to fit it, this is wrong, because the dorsal surface is already placed at the front, which I said that is not a way to determine it. So when you place the costal surface in front, then you have gotten it. Thank you. Let's go over to the attachment on the scapula.